and welcome to this conference hosted by MS Focus, the Multiple Sclerosis Foundation. I'm your host, Deborah Foreman, Educational Programs Coordinator for MS Focus, and I'm joined by Cherie Binns, who will be talking to us today about building a stronger MS community. After her presentation, we'll open it up to your questions and comments. Now I'm delighted to introduce our speaker. Cherie Binns is a registered nurse, an additional degree in gerontology, and is also an internationally certified multiple sclerosis nurse. She's a regular presenter for patient education programs for the Multiple Sclerosis Foundation and a writer for MS Focus magazine. I'm happy to say that as of recently, Cherie is also the patient healthcare liaison for MS Focus. Cherie was diagnosed with relapsing remitting multiple sclerosis in 1994 and has found that adopting some changes in her lifestyle has made her MS much easier to manage. So now I'm very excited to have her come in and talk to you. We're pleased to have her join us. Please go ahead, Cherie. You can tell us all about this wonderful topic. I've actually heard it before and I love it. So.
Oh, thank you. We actually were talking the other day about potentially resurrecting some of the programs that we had done years ago that had not been recorded, so therefore weren't available to the community. And building a stronger MS community was our theme 8 years ago. So I sort of resurrected that, but not the entire program. I kind of pared down the number of slides and added a few new slides to this. So basically today, what I'm gonna sort of talk to you about using this topic is a number of different things, making the most of your healthcare visit. We dealt with that relatively recently, so we're just going to briefly touch on that. We'll talk a little bit about how to choose an insurance policy that meets your personal needs. We'll also be talking about locating resources that you need. So without further ado, let me go ahead and share my screen, and we'll start with the slides. So the topic of that talk was building a stronger MS community, and we are stronger when we have the tools that we need, when we have the knowledge that we need. So that's why I think that's what this title spoke to me. This picture is 3 miles from my house. I used to go there a lot when I really needed to clear my head and think. It's called Hazard Rock, and I would put the hazards in my life out into that water and just let it float away into open Atlantic. I think sometimes we get to points where we just can't see the path ahead of us. We can't really identify where we need to go or how to get there. And when my husband took this picture while hiking in Vermont one day, it just leapt out of the camera at me as being very, very apt for how sometimes everything is clouded, everything is foggy when we're trying to locate a way through a tough challenge. So we're going to be, as I said, talking about our office visits, finding resources, getting help with medication copays, choosing insurance plans, and connecting with the MS community to get the most out of our care plans. So I talked a little bit about this, but without the visuals when we did our Making the Most of Your Healthcare Visit webinar recently. And I think it's very important that we go to a visit with at least some notes written down. That way we can focus our attention on what really needs to be done without, I don't know if you're anything like me, but I get into situations where, particularly if it's towards the end of a day and my appointment's like the last appointment of the afternoon, by then my brain is fatigued and I sometimes have to talk around things to get to where I need to be in my brain. So writing things down really helps. I usually make 2 sheets of what I'm writing down that I'm going to take into the appointment, so that I have one for the office and one for me to sort of cue me. And I'll show you that sheet in just a minute. But when you're writing stuff down and organizing your visit at the very beginning, you want to prioritize things. You may have 6 or 8 things that you want to bring up at the visit that you really need help navigating. Perhaps it's a medication renewal. Perhaps you'd like to try something that you heard about that's working well for somebody else. So really focus on, from your notes, really focus on what's the priority of that visit. If you can only do 2 or 3 things out of the things that you want to talk about, what are the most important 2 or 3 things to get you through till the next visit? I generally limit problems to 3 per visit. Sometimes you can sort of lump things together so that you can fit things into 2 or 3 categories. And you're going to have more time with your doctor or your nurse practitioner or PA if you really pare back on the wording. This form is very similar to what I take. I have my letterhead at the top of the form, so it's got my name, address, phone number, and email. And then I put the date of the visit and the name of the healthcare provider and my date of birth. And then I list, under medications, I list everything that I am taking by dose and frequency. I usually start with those things that are taken regularly, and then I do an as needed list, and then top it all off with any supplements that I'm taking. So if you're taking, for example, vitamin D, you want to list the dosage. For me, it's 5,000 units a day. And over-the-counter meds, if you're taking, say, aspirin or ibuprofen for achiness or pain, be sure you list that with the frequency and the regularity. Your concerns for that visit, keep them to 2 or 3 at the very top. Your concern might be related to maybe a mobility issue, or you're tripping over your foot, and maybe the spasticity is a little bit worse than it was, or you feel like cognition is getting worse. Then your question should relate to those concerns. So if it's something having to do with mobility or tripping over your foot, you might ask about whether or not a PT visit, an assessment by a physical therapist would be helpful to you. If it's about spasticity, you might want to talk about the medications you're taking. If you're taking anything for spasticity, you might want to question, if you're already near max dose on things like baclofen, whether or not to do a baclofen pump and get the doctor's take on whether or not that might be helpful. The beauty about a baclofen pump is that you don't get the brain fog that you do with taking baclofen orally. And because you're delivering a very concentrated small dose into the spinal cord area, so it sort of bathes that area with medication, and you don't need to take nearly as much as you would if you were to swallow it and it were to have to get into your system and find its way there. So make sure that your questions have a corresponding concern so that they can be appropriately addressed. Now, we covered all that in another webinar, which is up now on our YouTube channel. So if you want to learn more about how to make the most of your doctor's visits, go to the Multiple Sclerosis Foundation YouTube channel and find Make the Most of Your Healthcare Visit with me. Now, your healthcare plan. I'm hearing a lot on Facebook lately about people getting ready to go on to Medicare because they've been on Social Security disability for a couple of years and they now have the option of going on Medicare. For probably 8 years after I went on Social Security disability, my husband and I were still buying private insurance because I was fearful that Medicare would take away some of my choice with my healthcare plan. And some of your healthcare plans may do that. If you're in a PPO or oh, somebody help me. This PPO, I've lost the initials for those. So, or you may be in an HMO, a health maintenance organization, and that health maintenance organization may require you to see somebody in their organization in order for you to be covered by those plans. So oftentimes you'll find when you get into a health plan that if you don't look too closely, it may look really good at the beginning, but you don't see the dangers that lurk beneath the surface. And I, for one, found those dangers after I selected my healthcare plan. Although my disease-modifying therapy was in the formulary for the insurance that I took, I had no idea that the copay was going to be as high as it was when I had a zero copay when I was on private insurance. But my first month on Medicare, my copay was $2,200 per month for my disease-modifying therapy. Now, when you're on Medicare, the drug companies cannot help you with your copays or give you free medication. And that is a neat little loophole that got written into laws in first Massachusetts and then in Rhode Island, and ultimately was adopted by federal legislation that the drug companies cannot give any perks that would entice somebody to use their product. So while those of you who are on private insurance plans are able to get that assistance, those of us who are on federal insurance plans generally cannot. Whoop, sorry. Let's see. Problems getting meds or treatment, no matter what your political mindset, write to your congressperson. I know right now on both sides of the aisle in the House and Senate, there is a great deal of discussion going on that would put some restraints on the pharmaceutical companies as to what they could charge the individual. When you are on Medicare, I mentioned that high copay. The high copay is based on what the retail cost of the drug is, not on what your insurance company has negotiated to pay for that. So your disease-modifying therapy might be retailing at $9,000 a month. And the insurance company has negotiated a price of $5,800 a month that they will pay for it. They're still asking you to pay 40% if you're on Medicare of that $9,000 instead of 40% of what they have to pay. So Congress is very, very aware of that. You can also talk to your local representatives and senators so that they can work this on the state level, but certainly on the national level. Your doctor is a great resource getting medications that you might need. For example, your insurance company might deny you care in the sense that they want you to maybe be on a generic rather than the medication you have been on that's been working for you. Your doctor's office, almost without exception, will go to bat for you and write a letter stating that you're doing well on this other medication and you have the right to stay on that. And generally when that goes in, the insurance company will help you to stay on the medication that you've been on. The customer service of the insurance company I have found, depending upon the company, are very, very helpful. They'll go to bat for you. They'll work on trying to get a loophole that they can get you through to get what you need service-wise. So don't hesitate to use that 800 number that's on the back of your insurance card and call customer service. Insurance decision-making can make you feel like you're losing your mind because there's so many variables with your insurance. Most Health and Human Services for your state have somebody within that Health and Human Service division that will talk to you at no cost to you to help you navigate that selection process. The insurance companies actually train people to give you a presentation that will help out in your decision making. You don't pay them anything if they may give you a choice of 7 or 8 different insurances and highlight what the benefits of each of those policies are. And then whichever company you decide to go with actually gives them a finder's fee. So they are free to you to have their brains picked to help you get your policy that is needed for the conditions, the medications that you're dealing with. Many insurance companies, as I said earlier, will ask you to do, particularly if you've got a lot of the Medicare Advantage programs, particularly Blue Cross is the one I'm most familiar with, does want you to see specific individuals. We live in a relatively small state, very small state, Rhode Island, and the Blue Cross Medicare Advantage plan has all of their primary care and specialty care physicians located in one small area of the state. And for me, that would be an hour drive each way. So in order to keep my own doctors, I couldn't use those Advantage plans that have a lot of perks. Just look at what's most important to you and avail yourself of the help through your Health and Human Services office of your state. So you're going to call your congressperson if you're having trouble navigating your insurance, if you're having trouble getting a medication or a service that you need. Your doctor is a tremendous resource. The nurse in your doctor's office is used to navigating these challenges all the time. Customer service at your insurance company certainly can help. And then MS service organizations such as the MS Foundation, the National MS Society, MS Association of America, all can be very helpful to you. If you are outside of the US, Health Canada or the National Health Service in England, and the International MS Federation. So where can I find resources for medications? I made this list 8 years ago. There are 11 medications on here, 10 of which are disease-modifying therapies. Empira is not a disease-modifying therapy. It's a medicine that's used to help with walking. All of those companies do have copay assistance programs for people that are not on Medicare. So if your drug is not on this list, just type in the name of your drug and type in the search bar copay assistance, and it will give you a website and a toll-free number to call to get that copay assistance. Vocational resources. Perhaps you can no longer do the job that you've been working in because of fatigue or because of difficulty seeing properly or difficulty driving or walking. These are a couple of organizations that do help with vocational retraining. Also, your state's Department of Employment Security has vocational resources for free vocational retraining in every state. So contact them also for help in retraining. The MS helping organizations I've listed here. The MS International Federation is what I was talking about earlier if you're outside the US. They do have resources for countries that are not large enough to have their own MS society, or maybe don't have enough cases of MS within the country to have their own society, and they're extremely helpful. If you go to their webpage, msif.org, there are a great number of resources there in multiple languages. MS Views and News also has a good number of archived articles where you can really learn about a specific topic that you're trying to get more informed on. We just came through a summer weekend in late spring here in the Northeast where we had temperatures that were pushing 100 degrees. Heat exhaustion is huge for the MS population, although some of us are more cold sensitive than heat sensitive. About 90% of people who are living with MS tend to not tolerate heat as well as others. I know for myself, I can get outside doing something. I'm just so involved in the task at hand that I don't limit my time in the heat. I don't limit the activity. I don't keep as well hydrated as I should. And so next thing I know, I am beet red. I'm flushed, I'm overheated, I'm not thinking clearly. I'm starting to shake. I have a headache. I'm having trouble even putting one foot ahead of the other. My pulse is racing. Even a quarter to a half a degree elevation of your core body temperature can start all of this heat complex, which is also known as Uthoff's phenomenon. When we get overheated, it makes our MS symptoms feel worse. It doesn't do any damage to the central nervous system per se. It just ramps our symptoms up. So whatever is your primary symptom that you might have get worse when you're starting to relapse is going to be what's tweaked first. For me, it's balance and vision. I lose the vision in my left eye when I get overheated. So let your body tell you when you need to get out of that heat. We are only just a week and a half away from this year's closing date of our cooling program for the MS Foundation. We run a cooling program from February 1st to June 1st every year, where we give out free cooling garments. There is an application on our website, msfocus.org, and just look for cooling program when you get to that site. There is an online application that needs to be filled out. You do need to have some proof from your doctor that you are diagnosed with MS in order to get a cooling vest. And we do this program every single year and have for the last 20 plus years. I got my first cooling vest from this program, and I'll tell you, it was a lifesaver. There are different cooling products that work differently in different parts of the country. You may want to have one type versus other parts. For example, if you're living in Arizona, where it's very, very dry, the lighter weight evaporative cooling products may work well for you. Whereas if you're living in a place like South Florida, or even here in New England, where the humidity is extremely high, those evaporative products don't really work well. They may work for somebody that doesn't have the intensity of heat sensitivity that those of us with MS have, but usually I find that the inserts that are put in the freezer and frozen work best. There's also a product called Phase Change, in which If you don't have a good refrigeration system, and these are great if you're on vacation or traveling and don't have a freezer handy, the phase change products get solid and start cooling you once they hit 50 degrees. So you can run them under cold water or put them in a stream and get them charged to put into your cooling vest or collar. And all of those things are available in the cooling program. So you get to choose the type of product that really works well for you. If you're having trouble determining what might be the best product for you, feel free to give the foundation office a call. Their toll-free number is 888-673-6287, and ask to speak with somebody about some assistance with the application for the cooling program. If you have questions about any of this as an individual living with multiple sclerosis, I can certainly walk you through that, and you're welcome to email me at msnurse@msfocus.org. Now, there are several different companies that provide cooling products if you need them outside of our cooling program. Polar Products, I think, is probably our primary provider for those products. Steel vests. Also, steel vests have larger frozen insert packs. They're heavier. With all of the cooling packs in a vest, they weigh about 7 pounds, but the way that the weight is distributed, it doesn't feel as heavy on as it does when you're holding the vest with the cooling packs. So I wouldn't use that unless you really have a struggle with extra weight. Heat Relief Depot will give you a 10% discount on your order if you let them know in the comment section as you're completing your order that you have multiple sclerosis and heat insensitivity. They also, and I'm not sure if they're the only company that does this, they're the only company I've actually seen do this, that if you write a review for their product, they send you a coupon for 1% off your next order. I was talking about, oh, sorry about that, guys. I was talking about how I get really red when I get overheated. This is me in 100-degree heat with an evaporative cooling collar on. I was leading a Rotary Group study exchange team to India in February of 2008, or January of 2008, and every day there was high 90s, low hundreds. And the evaporative worked very, very well for part of the day, but I kept having, it was so dry there, I kept having to reheat or re-wet the collar in order for it to work. And as you can see here, I was really getting quite overheated, muddled in my thinking. So a cooling vest does me far better than what an evaporative collar would do or an evaporative vest would do. These cooling vests have frozen inserts. There are pockets inside in the lining of the vest that you put the cooling inserts in. This is not a commercial vest. It's one that it was one of my first prototypes. I've decided to make my own cooling vests. I find one that really fits and that I like, and then I go the extra mile by designing my own pattern from what fits me, and that way I have a choice of extra fabrics that I can sort of tailor to go with my outfits. During the summertime, I really don't leave the house without cooling equipment available to me. So even when I'm outside on a boat with the spray of the water in my face, if it's warmer than 70 or 72 degrees, I'll need a cooling vest on, even with the wind and the water. And that's just the degree of heat sensitivity that I have. A lot of people are not nearly that sensitive. Cool water is even better. I find that I get better exercise. I'm able to exercise longer in cool water. So you may want to focus your activity in the water if you have water available to do that. Now, at the beginning, when Deb introduced me, she mentioned that I found that some lifestyle changes really helped to make my MS symptoms a lot more easy to manage. Certainly, it doesn't take away. There is no diet that cures MS, despite what some people may say. The nature of our MS, if we're relapsing MS, is that we may get to a point where we have minimized the amount of inflammation in our central nervous system by some dietary changes that we feel that we have cured our MS. But relapsing forms of MS also remit, they get better, and they stay better until you do something that tips the scales again, which is one of the reasons we take disease-modifying therapies, because it minimizes that chance of tipping back and relapsing. So eating well is really important. Lots and lots of fruits and vegetables. Avoiding sugar that does not fall naturally into your food. So any sugared drinks, including juices, you should minimize your juice intake to 4 to 6 ounces of juice per day in natural format. A 4 to 6 ounce glass of orange juice has the calories of 4 oranges. So you just want to be aware that when something is liquefied, you're going to have the calories of all of it. For a while, I was doing juicing, and what you see on the screen is what I would throw into juice that would make 6 meals for me of vegetable juice. So you have to look at the calories in all of this and look at what you're actually putting into your body. The fact that you're eating fruits and vegetables doesn't mean that you can eat a whole lot more of something. Fruits and vegetables are great for you, but anything in excess is not good. Exercise is absolutely essential. Stretching and strengthening are the 2 main types of exercise that you are probably going to want to aim for. Certainly strengthening your core, meaning the abdomen and lower back, help to improve your balance. They help to prevent falls. They give you a greater ability to get up if you've fallen. So doing things that tighten the muscles of your abdomen can be very, very helpful. Certainly swimming is a good endurance exercise, good aerobic exercise that gets your heart rate up. The National MS Society, Health Canada, and the Consortium of MS Centers have all adopted a recommendation for activity for the individual with MS, that each of us gets 150 minutes of activity every single week. Something that is has us moving and not just being still or being sedentary. Now, in this webinar, I'll be sitting in the same chair for an hour or so talking to you and answering your questions, but that's not my routine when I am just going through my regular day. If I'm sitting at my desk working, I make it a point to get up every 15 minutes or so and walk, whether it's to go to the bathroom or to get a glass of water or to go to the mailbox or run upstairs to get something. I'm moving every few minutes throughout the day. So that 150 minutes adds up. It basically comes out to 30 minutes of exercise 5 times a week. And if you're mobile and you're able to take a walk around the neighborhood, you're using up a lot of that 30 minutes. They do allow for things like gardening, because you're getting activity, getting up and down and weeding and planting and raking and pruning in your garden. Things like doing the laundry and carrying your basket. All of those things provide activity that counts for that 150 minutes every day. I've got tend your spirit here because not just because we are spiritual beings, but also if we keep our spirit healthy, we have far less probability of falling into mental illness, into depression, into anxiety. Now, some of these pictures are suggestive of a faith walk. Certainly, if you are a faith-filled person, that's something that can play a major role in your mental well-being, in your overall outlook on life. But even if you're not, if you take that time to tend that inner spirit, to be aware of what your body is telling you, of what your thoughts are, where your thoughts are taking you, you can exert some control over that. We do have some mindfulness videos up on our YouTube page. There are plenty of articles on mindfulness and avoiding anxiety and depression on the MS Focus magazine online. So it's msfocus.org/magazine. And there are literally thousands of articles there that will help you if you don't know where to start, to get a place to jump off. Helping others is valuable. This was on one of the first cruises that I took with the MS Foundation. Before the pandemic, we were having an annual cruise that was an educational event. And there were two sisters that came on our regular cruises. And one was walking with Canadian crutches and the other was using a scooter. And the one that's using a scooter helps the one get the deck chair because she can't get the deck chair with her crutches. And the one that is in the scooter may not have access to something that she needs to get, so her sister who's on crutches can get access to that. It's not just helping others within the family. Ruth, who's pictured here, has the most wonderful, welcoming smile. Hers might be the only smile that somebody sees today. Yours might be the only smile that somebody sees today. And that can be very helpful to somebody. So know that no matter how deeply you feel you're impacted by this, you can make a difference in somebody else's life. And that difference just helps to peel away some of the difficulty in your own. Take up a hobby or skill, whether it's something that you've always wanted to do and now have time to do it, whether it's something that you left behind as a child and now have the time to revisit it. This is my youngest grandson, Eli, who will be 11 this week. And he's quite the musician. So actually violin was his first instrument, but he's now quite the pianist. I know that if I sit down with my flute or my harmonica or the piano, when I'm kind of feeling down, it can lift the spirits. So I encourage you to go back and revisit that sort of thing. My hobby lately, since the pandemic began, has been making masks. And as of today, we're over 9,500 made since September of 2000. So find something that you like to do and do it. It will lift your spirits. It will distract you from where you are. That may not be the best place. So these are just some tips on how to build your stronger MS community. And I want to thank you. And I'm just going to close this out, and we can start taking some of your questions.
Okie dokie. Thank you so much, Cherie. That was wonderful. And so let me explain to people how they can do that if anybody's unfamiliar with how this works. We are ready for questions. And if you have a question or a comment, we suggest that you ask that through the Q&A button in the app, which also allows you to send your question in anonymously if you choose to do that. Or you can ask your question live by raising your hand to do so. If you want to raise your hand, you have to push, if you're on the phone, you have to press the number 9. Okay, so I'm going to call on you. You'll say yes to let me unmute you, and it'll all be good. Now, let's see if we have any questions as of right this second.
Hover your mouse over the bottom center of your screen, and that will show you where the chat and the Q&A are.
Yeah.
I have this issue eating healthy. There
we go. Okay,
Holly, can you enlighten us as to what the issue is?
Let's see. Well, okay, so we have, you're seeing one for Holly. I'm seeing, I see Hallie, right?
Hallie,
yeah. Party. She's saying that she has an issue eating healthy. So she didn't say in what way, but she does have an issue eating healthy.
Okay, Carla is asking what my thoughts are on human stem cell treatments, or as a treatment option instead of drugs. It's stem cell, when we first started doing stem cell treatments, we were seeing phenomenal results. It's not an easy treatment by any stretch of the imagination. Your immune system, you have to have a bone marrow biopsy done. They take your bone marrow, they save it for your stem cells, then they give you chemotherapy at very high doses to knock your immune system down. You feel horrible. Selma Blair has a couple of videos up on YouTube about how awful she felt when she was going through her stem cell therapy. You're vomiting, you can't keep anything down. You often will get thrush, which is a yeast infection in your mouth, so that it hurts to swallow anything, including water. You'll probably also get yeast infections from knocking that down. And then once your immune system is knocked down, they give you back, they spin your stem cells out of your bone marrow. They give them back to you, treated, to reboot your immune system from healthy stem cells. And it takes probably 2 to 6 months after that before you start feeling even human again. But by that first year, a lot of people are beginning to get function back that they've lost. Stem cell therapy is really, at this point, it's so expensive. It's about $500,000 to $1 million for each stem cell transplant that's done. And most insurances don't cover this. So to get into a clinical trial on that is really kind of the way to go. It also doesn't work for everybody. It's recommended that people that seem to have the better results are younger individuals, like below the age of 30. Men seem to do a little bit better with it than women do. And what we're finding is that it really generally only lasts for about 4 to 5 years before you begin to decline again. So it can give you 4 to 5 years of extra really good time. Now, instead of drugs, your doctor, that's a conversation to have with your doctor. Your doctor may feel more comfortable having you keep a disease-modifying therapy on board just to prevent any further damage that can happen even after the stem cell treatment. So that's a question that you need to take up with the doctor.
Casey's asking, how do you manage giving up sugar? What steps do you take to get it out of your diet? Not an easy answer, right?
No, it's not. When I tried weaning back, and I find that sugar is so addictive, you can't wean. You got to go cold turkey. And it generally takes between 4 and 6 weeks to really get it out of your system. I gave sugar up in 2005, and now I might have, like if we're going out to dinner or there's a special occasion and there's a dessert, I'll have a taste of it. I certainly won't have a piece of it. And I find that taste of it often is way too sweet for me now. The piece of it ramps my MS symptoms back up again. If I have even a 1-inch sliver of pie, my husband loves my pies, and so I will pretty regularly make pies. But if I have even a 1-inch sliver of pie, the next day I'm achy all over. My vision isn't as good as it was before. I'm more irritable. I have trouble emptying my bladder. So it does ramp up a lot of those MS symptoms. And getting off sugar entirely is probably your best bet. No more Cokes or orange Fantas or anything like that. Those are real killers. Not only that, but when you're eating a more sugary, less nutritionally dense food, you're not getting the nutrition you need, you're adding extra empty calories, and you're setting the stage for adult onset diabetes. And adult onset diabetes with MS just complicates things. I know a lot of us, I have diabetes in addition to my MS. MS is generally not the only condition that we are living with. Many of us have more than one autoimmune disorder. In addition to conditions that we might expect based on family history that we're going to get when we get a little older. So the dietary changes and the exercise really go a long way to managing the other health conditions that can get in the way of good MS management. And you know, the more things that you can manage and control, the better the outcomes with your MS, as well as the other health conditions that you might be dealing with.
Yeah, Cherie, I know I have a couple friends with MS, and for them, the key to success has been staying active. And really, I mean, exercise, and it's not always easy for them, but that seems to be the key. And I wanted to ask you about vegetarianism or veganism for MS. Do you see any results with that for any of your patients?
Yeah, I do. But not with everybody. I mean, there was a book out maybe 4 or 5 years ago looking at diets for blood types. I don't know if you remember seeing that book, but they're saying that there's one way to eat if you have the O type bloods, and there's other ways of eating if you have B or if you have A. And I don't remember which was which, but they're very clear to say that even though this is a guideline, even though these are observations that we made, it's not that way for everybody across the board. So I think certainly you don't want to shut the door on good nutrition for yourself. So if you want to, for example, become a vegan and not eat any animal products, you have to be sure you know where you're going with that. You have to be sure you know where you're going to get your fat, where you're going to get your protein, if not from animal products. So it's incumbent upon you not to just blissfully go off and say, I'm going to eat a vegan diet or I'm going to eat a vegetarian diet without knowing the consequences of that, without knowing that you're not going to be developing malnutrition by the way that you're eating. So be an informed consumer. Certainly if you ethically have a problem with the consumption of animal products, you're going to want to learn how to feed and fuel your body so that it's highly functional, so that you're not dragging, so that you're not knocking your energy level down. You're getting the nutrition you need to get the energy that you need to function, to keep your brain active. I don't do well long-term on a vegetarian or vegan diet. I mean, I know how to eat it, but I find that my energy just wanes after a week or two without some sort of animal-based protein, even if it's just cheese. So know your body and really be responsible about choosing what it is you put in it.
You know, I see that as I get older, a lot of when we used to have the live educational programs, the face-to-face programs, and people would ask if this particular pain or this particular ache was related to MS. And I know that not everything is related to MS, right? We could say everything is related to MS or everything is related to whatever your illness is, but a lot of it is just aging. So we have to keep a perspective of that. And I think if we were to keep a perspective like that, we would understand. I think we'd feel better about what we're living with, because we're honored with the ability to grow old, and yet not everything is MS related, right? If we think everything is MS related, we can get very depressed. But if we think, okay, well, some of it is also just the luxury of growing older.
It is, 40, 50 years ago, our life expectancy was upper 50s with MS, whereas the average life expectancy was low 70s for the general population. Since the advent of disease-modifying therapies in the early 1990s, our life expectancy has been increasing. And the reason for that is that we're not getting as debilitated as quickly. We're not being as sedentary. When somebody becomes chair-bound or bed-bound, they're not moving. Their skin has greater potential of breaking down. Elimination becomes a problem. Urinary tract infections are more common. Pneumonia is more common because you need to be moving to get your lungs filled. And so it was generally pneumonia or a urinary tract infection or bed sores that took people out early, a half a century ago. Now, our life expectancy is only about 6 to 8 years less than the life expectancy of our counterparts who are not living with MS. And that continues to narrow as we get better medications to manage our MS, as we get better insights into and buy-in into lifestyle changes and ways to manage other, what we call comorbidities, other conditions that we've got that, as you said, may be related to aging, things like diabetes, hypertension, thyroid disease. All of those things, if they're well managed, help us to manage our MS better. And certainly, yeah, I see Oftentimes people saying, my vision's terrible. I'm only in my 30s and I've got all these floaters in my eyes. And let me tell you, everybody has floaters. As we get older, they're little clumps of protein that clump inside of our eye. And as they first appear, we become aware of them. But over time, we really have to focus on them in order to really see them. They're still there. They just don't bother us. We get used to them. And they're not MS related at all. So if you've got visual problems where you're seeing floaters, it's not MS. It's just a natural function of getting to be an adult. Not even getting older, getting to be an adult. Certainly, as we age, if we're not really aware of and practicing moving and strengthening and keeping our bodies, the physical plant fit, we get weaker. I mean, weakness is a function of aging, but we can, we can manage that just by pushing ourselves a little bit, by making it a part of our daily routine. The stairs that you see behind me, there was a time when I really couldn't even make it up one flight without some assistance. And now I'm up and down stairs a dozen times a day, and I don't even give it a thought. So little things like that, build on it. Even just stepping up one step or two step and back down again. Get started like that if you're, just as long as there's something stable like a railing you can hang on to. A little bit, baby steps. Somebody put up a meme on our Facebook page the other day. Don't get discouraged about not being able to wash that sink full of dishes, wash a dish. Don't be discouraged about folding that basket full of clothes, fold a piece of clothing. And it's all about those baby steps and taking the initiative to do something that you can't eat the whole meal, but you can take one bite and chew it. It's all about that concept of starting little, baby steps.
Yeah. Cherie, there's one last thing that I wanted to mention. And if anybody does have a question, please feel free to, once again, put it into our Q&A down at the bottom or raise your hand. But, the importance of if it's available, going to a comprehensive MS center versus just a regular neurologist, or even possibly a neurologist that's all by himself that's not associated with an MS center. I see from folks that I answer the phone for, really such a huge difference in the care that people have available to them at a comprehensive center. Really,
it's huge.
It's just huge. And I don't know.
It's huge. And
not everybody knows that they exist, really.
Well, they didn't used to. They're more and more common. When I was diagnosed finally in 1994, there were just a handful of MS centers around the country. Boston's 2 hours from where I live, and I was diagnosed at an MS center at the Brigham. And I asked if I needed to go back there for my care, and they said, no, you don't have to make the drive. Maybe come here once a year, but see a local neurologist. And so I knew somebody that had MS and asked who his neurologist was, and he told me. And so I just blissfully went, and he set about immediately, because I was walking and working. He didn't think I had MS because my friend Cherie was so deeply impacted by it. It turned out Cherie was the only MS patient he had in his practice. But by the time Cherie went to see him, Cherie was already wheelchair bound. So it wasn't like he was seeing that progression. The MS centers are doing nothing but MS, or they have doctors in their MS centers that that do nothing but MS. Now, we have a neurology center not too far from here that has a couple of MS neurologists and one nurse practitioner that's strictly MS, and they have an infusion center, but they also have other doctors that deal with movement disorders or migraines. So it's a neurology practice. I would say if you're going to a general neurologist or a neurology practice, find out what they know about MS, find out how many patients they've got that have MS. And if they've got at least 100, preferably at least 500 practices or patients within their practice that have MS, they may be okay to manage it, but they also may be married to a therapy because it's what they're comfortable with. I know one practice here in our state that's got easily 5,000 or 6,000 patients in the practice, with nearly 1,000 of them having MS, and yet they're still using the first generation injectable medications rather than using something that's a little bit more effective and that could be taken by mouth or via infusion. So they may not be keeping up to date on it. The comprehensive MS centers also are likely to have physical therapy on site or neuropsychological testing if you've got cognitive issues. So I would say if you're choosing a new practice, certainly the MS Society has a physician locator for people with MS. There's a website on the National MS Society that's devoted directly to physician finder. So the doctors that are on that finder usually are pretty well schooled in treating MS, even if they're not a comprehensive MS center and there's not one near you. You might also consider traveling. I mean, if you're only going to be seeing the MS neurologist twice a year, certainly you could do a day's travel, a night in a hotel, and a day's travel home. And that's it if you've got the facilities to do that, if you have a car, if you have the financial resources to do that. So there's lots of ways around that.
Yep, good information. Thank you. So I think that brings us to the end of our time. If you've missed any part of this conference, it's been recorded and will be available through the MS Focus Facebook and YouTube channels. Please reply to your registration email for information on how to access the recordings or to sign up for our newsletter to learn about upcoming events. Also, you'll be receiving a short survey when you leave the conference. We greatly appreciate your feedback, which helps us determine what type of information is most meaningful and helpful to you as the attendees of these conferences. Without you telling us, it's all a guess for us. We try based on everything that we learn from you, but really to have you tell us what you want to hear and what's important to you would be the best. So take advantage of that option. Our next teleconference is going to be Tuesday, June 14th at 3:30 p.m. Eastern. Our speaker is going to be neurologist Dr. Ben Thrower. He'll be answering your questions for an entire hour that day as we present a town hall style Q&A. Our sincere thanks to all of our attendees for your participation, and especially to Cherie Binns. Thank you so much for the time you spent to prepare and share this information with us, Cherie. Goodbye, everyone, and we'll see you next time. Bye.